I think it only takes a parent that has an autistic kid for to be able to understand me. You never know how it's gonna. You can go to bed in the night and plan your day the way the next day is gonna be, and the child wakes up by 2 a.m. and something is wrong, and all of that plans out the window. So it is hard. You want to do the best you can to give your child the best quality of life that medicine can give that child. I would still like for my son to go through with the stem cell therapy treatment. After listening to some of the parents I've met here, I think I'll really be glad to come back next year.
Can you please tell me what's your name and where you're from?
My name is Jennifer. I came down from Ireland. I live in Dublin, the Republic of Ireland.
And what brought you to the clinic?
Um, I came to try to. I heard about the stem cell therapy for autism, and that is the reason why I came. I have an autistic son, who is 14, and as a mom, you just want to do the best you can for your child. So I came to see what kind of help I can get from the stem cell treatment for my son.
And how did you know about stem cell therapy?
I think it was 4 years ago. It's not even stem cell therapy. I'd never heard about stem cell therapy, but I think it was 4 years ago. My sister-in-law in Switzerland had mentioned Swiss Medica to me, and then my brother sent the name, and I was asking him, who are these people? He said he's heard about the stem cell therapy for autism, that is worth checking out. So I started doing research on my own to understand stem cell therapy for autism, how it works, what it does, if the advantages and disadvantages, the side effects that might come out of it. And after doing that kind of research, I also have someone in the medical, there is a medical practitioner in the family. So I did speak with her as well, and my sister did some of her own research and her own finding, and told me this is what she found. And I'm a researcher myself by profession, so I did do quite an extensive research on stem cell therapy generally, and stem cell therapy in relation to autism, So, and again, I did a bit of research on Swiss Medica, before making that decision. But, at the end of the day, it's not what I found per se, is the drive to be able to give your child the best quality of life that you can. So for me, that is the driving force for me as a parent.
Getting back to the point when you mentioned that you made a research about stem cell treatment, stem cell therapy related to autism, what have you specifically heard or seen, read about stem cell treatment that you decided to give a try?
To be honest, the area is still being researched, but and it's not the research sometimes it's not easy to just come in. At least it's becoming easier. 4 years ago, it was not so easy for me to find articles on it. But I know that this year more articles, more medical journals have been published on stem cell in relation to autism. So, and some of the benefits is that it improves the speech. Again, they say it works differently for different individuals, And again, one of the things I came across in one of the journals is that the therapy works better when the individual is still younger. That's what I heard. I found in one of the journal articles, but that it can improve the speech, the general cognition of the child, the fine motor skills, all of those things that you see lacking in a child with autism, especially when the child is on moderate to severe spectrum.
And have you got any fears related to stem cells?
I think as a parent, whatever procedure your child is going through, you always have fear. Whether it's even something as simple as going in to take out appendicitis, there's always fear for when it's got to do with medicine, because even the simplest things can go wrong, So for me, I don't approach things with fear. If I've made up my mind about something, I just go for it. I'd rather go for it. I'd rather try and fail I can live with failure. I can't live with regrets.
Mm-hmm.
So for me, I'd rather try and fail than to live with regrets 10 years from now, 5 years from now, thinking maybe I should have, maybe I would have. For me, failure is acceptable. Regrets, I can't live with that.
Mm-hmm.
So I have no regrets coming to do this for my son.
Can you please describe me about the condition of your child?
My son, he's autistic. He also has other underlying medical conditions. For example, he also has type 1 diabetes. So, but you know, I had consultation with the doctors from Swiss Medical, and my kid sister, who is also in the medical field, had consultation with one of the doctors from Swiss Medical, because she is in the medical field. She'll know better what kind of questions to ask that myself as a researcher might not know what to ask. I might be asking the basic common sense things, but she'll be asking more medical stuff, if you know what I mean.
Mm-hmm.
You know, so I had consultation with one of the doctors, and I did, you know, highlight all of these underlying medical conditions so that they are aware, you know. So it's with the knowledge of them being aware of other underlying medical conditions, and ensuring that the treatment, you know, will also align with, despite all of this, that there will be no side effects for my son, you know. So yeah, aside from autism, he has type 1 diabetes as well.
And regarding this consultation, as far as I understand, this consultation were held online or in the clinic?
No, I had that online.
Online consultation.
Even before I came.
Okay.
Yes.
And what were the results of this consultation? Probably you, as a result of the consultation, you had some specific expectation about the treatment, side effects and stuff like that.
Yes, I did. For me, I think that was one of the biggest things first of all, for them to understand the underlying conditions. And for me to also understand that despite these underlying conditions, the treatment is not going to have any negative side effects on my son. And they did tell me, you know, some of the side effects that might happen generally. But again, almost with all medical procedures, there are always side effects. It's now for you to be able to weigh the side effects and know, is this worth it or is it not worth it? And the truth of the matter, as a parent, for me, it is worth it. Because in as much as I understand what the side effects are, I also understand that if it goes well, it's going to improve the quality of life for my son. And that is what I focus on, the quality of life for my son.
What challenges were you and your child facing due to autism?
I think it only takes a parent that has an autistic kid to be able to understand me. Otherwise, it's really hard for, even no matter how much you explain it. Sometimes people might, you know, be sympathetic towards the situation and the condition, but they can never understand. You need to walk in my shoes to be able to understand me. If you don't walk in my shoes, you can never understand where I am coming from. But other parents out there that do have autistic kids, they know it's, you know, it's from one day to the other, it's one thing. You never know how it's gonna. You can go to bed in the night and plan your day the way the next day is gonna be, and the child wakes up by 2 a.m. and something is wrong, and all of that plans out the window. So it is hard, you know, and I am also a single parent, so it is double hard. Even for a home with both parents in it, it's hard enough. But for myself as a single parent, raising my son by myself, I can't even begin to explain it for one to understand. It's hard to explain.
What have you seen? You mentioned that you have seen or heard something about Swiss Medica, that you decided to go to Swiss Medica. Do you remember?
Yeah, to be honest, when I was coming here, I didn't know what to expect, you know, but I was going to take any chance that will improve the life the quality of life for my son. I didn't know what to expect, even though I've done all the online consultation with your medical practitioners and all of that. But I was pleasantly surprised when I came, from the reception, picking up at the airport. Um, everybody is so helpful. Everybody is so friendly. It's almost unbelievable, you know. It's almost unbelievable. It seems unreal. The friendliness, the support. But more importantly, I think for me, more importantly, is meeting other parents, because I've met parents here from practically from everywhere. You know, I've made friends with a couple of them from England, because England is very close to Ireland, so it does make sense for me to make friends with a couple of parents from England. You know, we have exchanged contacts so that we'll stay in touch. You know, I've been able to speak with them. At least one of them, this is their second time here. You know, I've been able to speak with them to understand what sort of improvement they've seen, which prompted them to come and do it a second time for their son, to see if that will help their child even more. So I think the experience, aside from the therapy itself, the experience from the staff, like from the doctors to the receptionists to the cleaners to the caterers, it's so unreal. It's unreal. You know, everybody has been very friendly and very helpful. It's almost unreal.
Anastasia told me about challenges that you faced during the procedure. Can you please tell me a little bit more about it?
Yes. Like I said, my son has other underlying health issues, yeah. And after the first treatment, we encountered a bit of difficulty. But I think for me, what was important was that after the difficulty we had, the doctors came to me and said that they've taken the decision to stop my son's treatment, not because they don't think he should continue, but because they think it's better to for me to go back and have his own doctors back in Ireland take care of certain health conditions before I come back. So, and I was very appreciative of the fact that they were thinking more about his health as opposed to finishing the treatment. In as much as it's, it costed me money to be able to fly in here, and I'll be flying back without the results that I expected because I wasn't able to continue the treatment. I'm still glad I came. I'm still glad I came. I'm going to go back home, you know, consult with his own doctors back home in Ireland, and see how we can proceed with his treatment back home. And once there is improvement, then I'll be able to consult with the doctors here to see look at the improvements. Is it okay for him now to be able to continue with that treatment? You know, because I'd still like for my son to go through with the stem cell therapy treatment. After listening to some of the parents I've met here, and they're, from everywhere, from England, from Italy, from Portugal, from India, they're from everywhere, you know. So after listening to some of the parents here, I think I'll really be glad to come back next year, sometime after consultation with the doctors, for my son to have that treatment done.
So, did you afraid coming to Serbia?
I was. Look, I'm gonna be honest. I was, especially as a black woman. Yeah, I'm gonna keep it real. Yeah, racism is a reality. I didn't know what to expect, and I travel a lot because of my job, and I've gone to countries where I've met racism blatantly in your face, like in your face. So I wasn't sure what to expect. And was I worried? Yes, I was. But my experience so far, and I'm going to be honest and keep it real, I haven't gone into town so much, but I've gone for a few days. But I'm gonna say I've been pleasantly surprised so far. People are quite friendly. I wasn't sure what to expect when I was coming, but people are quite friendly here in Serbia, and for me that's a surprise. I I don't know. I think it's a very pleasant surprise for me. Though I did meet a Serbian girl through work 2 months ago, so I did let her know, and we've kept in touch, and I did let her know I'll be coming to Serbia, I'll be in Belgrade, and she's been able to take me around and all of that. But overall, I think people are quite friendly, and I don't know what I was expecting as a black woman, but one thing I do know, that racism is real, and I've encountered that in a lot of countries I've been in. I haven't seen that yet in Serbia. And that is not to say there is no racism in Serbia, but I haven't encountered that. People have been quite friendly, to be honest. And for me, that's a pleasant surprise.
If you want to say something additional, you feel free to say anything.
I think like I had said already, taking care of a child with autism is very challenging. It takes a lot out of you. It takes the grace of God to keep your sanity, and that's the honest truth. And even for two parents, a household with two parents, it's hard. And for a single parent household like myself, I can only imagine, based on my own experience, what people are going through, especially if it's a single parent raising an autistic child. So, and I know, like other parents with autistic child or with other forms of disability, that you want to do the best you can to give your child the best quality of life that medicine can give that child. So as much as there is not much said about stem cell therapy for autism out there, as much as we don't know so much, the reality is that any parent, any chance you have to be able to give your child an improved quality of life, you want to take that opportunity. And for me, I have one simple motto: I'd rather fail than regret. I have no rooms for regret. I want to go and try and fail. I can live with failure. I can't live with regret. And this is my son. My son. I don't want to have any regrets 5 years down the road, 10 years down the road, that there is something I could have done for my son and I did not do that. I can't live with that. So, I don't know, like other parents like me out there, I'm sure you want to do the best for your son, just like I want to do the best for my son. And that is why I came. And even if it's somewhere else I hear tomorrow that there's something better, I'm still going to go and try for my son. And that is me speaking not as a professional woman. I'm just speaking as a mother. Thank you.
Thank you very much.